Can you hear me?
Yes.
Yay!
Oh my goodness. I cannot figure out Instagram. Hopefully I'll figure this out.
I don't know what's going on, why it's not coming through on my end. So hopefully everybody else is seeing this and they can join and flip on over to this place. So.
Oh my
goodness. Yay! See, Vanessa, thanks for joining us. See, we had the same issue with Vanessa a few weeks ago when she couldn't hear me. But then when she started on her end, we could hear each other. So I don't know what that is.
So will this still record?
Well, it'll record on yours. So what I'll do is I'll go into your recording and I'll record your recording.
Wow.
Yeah. Yes.
Okay.
Yes. And then once we do that, then I'll upload it to my YouTube, and then that way I'll link it. So yes, Vanessa and I remember that turmoil very clearly. So, but we figured it out. So people will find it eventually. It'll be up. So.
All right.
Yes. So thanks for joining us, Disha. I'm so glad that you could join us and talk about your experiences on your day. I mean, because you're working today, right?
I am.
Yes. Yeah. Okay.
Yeah. I'm trying to keep my pager quiet.
Yes. Okay. Well, good. We will keep this nice and short and sweet and direct. And I wanted to welcome everyone to our Instagram Live. We're talking about Infant Loss Awareness Month, along with a whole bunch of other awareness months we've been talking about this month. And we've addressed postpartum depression. We've addressed ADHD, SIDS. We've talked about a whole bunch of different issues that are really important to just kind of be aware of. And so Dr. Disha Mookherjee wanted to talk about her experiences with navigating the loss of a child that she experienced back in several years ago now. And I wanted it to be more of kind of her personal experiences in terms of what she experienced. So thank you so much again for joining us. And why don't we just kind of jump in and talk about what we're going to talk about? So why don't we start out by you telling people who you are and what the early part of your story is, how all of this kind of transpired and happened.
Okay, so I am a cardiologist. I'm going to try to make this stand. Sorry. Okay. So I'm a cardiologist, and back in 2008, 10 years ago now, I was in training to become a cardiologist, and I had been married a year and had the good fortune of becoming pregnant with our first child. My husband and I were ready, and we had a great pregnancy. It was wonderful. We were really excited to start our family because we've been together for 8 years already anyways. So we were ready to jump in. And I timed it out perfectly, and meaning with my training, because it's a 3-year specialty fellowship that you have to do. And so it was in the second year of my fellowship that I decided to get pregnant. And fortunately, we got pregnant easily. And then basically we went through the pregnancy, and the baby seemed like she was growing a little small. And so the doctors recommended that maybe we should just do an induction at 39 weeks. And I was thrilled about that because my back was aching, and all my friends who had inductions said that it was great. It would go really fast. They were out by noon. And so that's what I was, I never thought anything of it. And and so we went in for the induction, and basically what happened was everything went a lot slower than we had anticipated, and it went into the next day. But finally, it was time to push, and basically the doctor who was taking care of me had used a vacuum on the baby's head in an effort to try to help her come out. And it didn't work. And after some time, we had to go to C-section. And what ended up happening was that I heard her cry just once. And then I heard the doctor say that the baby needed to be resuscitated. And so they had to perform CPR on her for 20 minutes. She survived that and was transferred to another hospital. And because they were going to be doing some kind of a treatment called a cool cap treatment to try to reduce whatever injury had been done to her brain. And at that time, I really didn't know what was going on. I was like, oh, I've seen other friends of mine have had babies in the NICU and stuff, and they've done fine. That happens all the time. I didn't think anything of it. And my sister, my best friend, my husband, they were all with me. And And, but by her second day of life, she was actually brain dead. And, yeah. And so, I'll never forget my sister and my husband coming to me and telling me that they were showing me the EEG report stating that it was electrical silence. And I said, that can't be. I'm like, did they check the wires? Did they plug in the machine? You know, and you know what? Even now, today, I can be right back there.
Of course.
Yeah. And I remember like it was yesterday. And it was at that moment where my husband said to me, he said, sweetie, he's like, there's nowhere I want to be except next to her side. Like when I finally saw her, I just want to protect her. He's like, but I know that we can't keep her this way, you know? And I was like, oh my goodness, how could this happen? So anyhow, because I had a C-section, I had to stay in the hospital for 4 days. I was not ready at all to be giving up hope or anything like that. And however, by her 4th day of life, it became clear that there was not going to be any kind of a turnaround. And so we decided that we would take her off the ventilator. And so during that time, they had kept her on before that, like they had kept her with the cool cap on. And, you know, I hadn't even held her. And so I kept saying, I'm not going to take her out. You know, I haven't even held her yet. I have to hold her. You know, but the last day that I was in the hospital and I was going to get discharged, they called me and they said, you know, she's not doing well. Would you know, they were kind of asking me like, what are your wishes for her? Like, should we do CPR on her or not? And I was like, I'm coming. You keep her alive because I'm coming. And because a dead baby is not who I'm going to hold in my arms for the first time. I haven't even held her. Do everything you can. And I rushed over there. By that time, my parents had flown in, my father-in-law, my brother-in-law, a lot of people had flown in to see her. And on the way to the hospital, my husband and I had decided together how this was going to go down, which was basically I wanted all the testing done because at that time we didn't know what would happen to her. We didn't know why she was sick. We didn't know what was going on. But I knew that, you know what, I'm her mother. I gave her life. I was going to be the one who was going to take her off that ventilator. And I was going to bathe her. I was going to be the one who took all the tape off of all the things that were, all the tubes that were on her. And I was going to do that because I'm her mom. And so we did that. And when the doctor came in and told us that, she wasn't going to be able to survive, I just looked at my family and I said, look, this is what we're going to do. And you can stay and watch if you want to. If it makes you feel uncomfortable, you can leave. And that's it. That's how it's going to go down. It's like, you know, when people talk about, like athletes talk about being in the zone and they're like there, they know exactly what to do. That was like all time stood still. Boom. I knew exactly how this was going to happen. And this was going to be my chance to show her all the love that I possibly could. So I was not going to not do that. Right. So fortunately, we were able to bathe her and everybody stayed. Everybody got a chance to hold her. And the nurses and the social workers were so amazing. And they kept encouraging me to allow them to have their photographer come. And I was like, that's weird. No, thank you. But then they kept saying it. They kept pushing it. And they were like, you don't ever have to look at the pictures if you don't want to. And I was like, finally, I was like, okay, fine. They're like, it's free. I'm like, okay, all right, I guess that's fine. And let me tell you, it was the best decision of my life because the pictures that they were done by Todd Hochberg and by Touching Souls Photography, and the pictures, the album that he gave me, those pictures, which I hopefully will share one day with as many people as possible, are a love story. They are a love story. With my whole family holding her, kissing her, me holding her. I got to hold her skin to skin. My husband got to hold her skin to skin. And we took our time. And finally, she passed in my arms. And it was interesting because the doctor came in and listened and said, okay, time of death is 12:39 a.m. And I looked at her and I said, that's my time of birth.
Wow.
4
days earlier.
Like my personal.
Oh, your time.
Personal time of birth, right? Like on your birth certificate when you're born.
Yeah.
12:39 a.m. And her time of death is 12:39 a.m. Yeah. And man, like,
wow.
Yeah, crazy. And so to me, there are no coincidences.
No.
There are none.
None.
And, it's been 10 years. And the journey that I've been through has been a journey of love.
Mm-hmm.
A journey of becoming my authentic self. My journey into spirituality and trying to make sense of all of this. How? Why? Why did this happen?
Right.
Why not? It can happen to anyone.
Yes.
And so I've just learned so much, and it's helped me become the doctor that I am today. And it helps me connect with my patients, especially the ones who are grieving the loss of a spouse or a child or a sibling or whatever, in a way that I never would have been able to do if I hadn't experienced this. And she's touched so many lives.
Yeah.
Mm-hmm.
That's a powerful story, Disha. That's really powerful. What went wrong? What went wrong? It was a healthy pregnancy. Everything was going well. What went wrong?
So the vacuum caused a large bleed. And there was a lot of time that was taken in between using the vacuum and then the delivery. There was about 3 hours in between. The incorrect vacuum was used. And so it just basically, she bled and it decreased the oxygen to her brain. And so she had hypoxic ischemic encephalopathy.
Okay.
Which led to uncal herniation. So like her brain swelled, and that's what happened. That's what happened. Yeah.
Do you feel like it's important for moms and dads and families to, in order to grieve the loss of their infant, do you feel like it's important for them to know why? What went wrong? What happened? That it adds some kind of closure? Or do you feel like not so much? It doesn't make a difference?
I think in the first several months to even years, you're always asking why did this happen? Why did this happen? And I guess for me, I was in some ways I was fortunate to know or figure out. It took a long time to figure out what it was exactly that had happened, and to put the pieces together. But I also have many friends who have had stillbirths and don't know why, or have miscarriages, don't know why. And I think the grief of the loss is still there, no matter what the mechanism.
Right.
But I think it's very natural and normal to try to find out why. And I think it's important, if you feel that you need to figure out, to do that investigation and do whatever you feel you need to do to figure that out, knowing though that you may not ever find out. For many people, they don't find out. Right. So I don't know if I answered your question, but...
No, I think, I think in a sense, I don't know if it's that cut and dry, because I work a lot with trauma, various types of trauma. And I think one of the biggest griefs besides losing your child is a complicated, unresolved grief, where you lose somebody, whoever it is, and you have no clue what happened. So, if I work with a soldier who was missing in action, a soldier's family who was missing in action. And so they're like, well, is he a prisoner? Is he alive? Is he dead? And sometimes then also, even if you lose somebody unexpectedly, especially a baby, and you're like, you have no answers, whether it's through SIDS or through an infant loss, you know, and you're like, well, but give me answers. Help me to at least know, was it my fault? Was it the doctor's fault? Was it someone else's fault? Was it just a freak accident? Like, help me understand. And sometimes it gives a sense of kind of consolation, and like you can feel like, okay, well, now that I know the reason, maybe I can grieve better. But then sometimes no.
Sometimes no, right.
Sometimes no.
The other thing that I've definitely learned over the years is that you can't predict when somebody's going to die.
Right.
And death is a truth for every living being. Every living being. And I remember back, I shared my poem with you, and I remember in my poem I had written, why do some people get to live over 100 years and have so many experiences? And some people, and Maria didn't even get 4 days, right?
Right.
And so we can think of it that way, but we know that there are people who, only live, 10 days after conception, right? To 120 years old, and young people who die of cancer and traumas and all of that. And for me, okay, I'm talking for myself personally, we often see death as a failure. And like it's not supposed to happen to anybody.
Right.
Ever,
right.
I see that, I'm a doctor. I'm trying to keep people alive all the time,
Yeah.
And I'll tell them, look, this is not your day. I'm going to be helping you. This is not your time that you're giving up. And so, but here's the thing that I've realized is that death is a normal part of our life cycle.
Yeah.
How we go is up to source, the universe. And so what we do with the time that we have is so very important. It's so very important. And so it's not necessarily, that person lost their battle against cancer or heart disease or whatever. It's like nobody's living till they're 300 years old,
Right.
It's something will get all of us at some point. And it's just the normal cycle. It's just the normal cycle, life and death. And so it's so important that we're here. I truly believe that every single life is here on this planet for a reason and a purpose. And I believe that even though Ria was only 4 days old, that she served her purpose.
Yeah.
And the fact that I'm talking to you today is testament to that.
Yeah. 10 years later, right?
Yep. 10 years later. Yep. 10 years later. Yep.
So then what was helpful and instrumental to you, Disha, in your healing? Like how that process is not an easy 5 stages of grief process.
No.
It's not at all.
No.
And even though that's how we would like to see it, that's not how it works. And so how did you heal? How did you move through that process to get to the point where you're here today to be able to talk about it?
Right. So the first thing that I did was go to an infant loss support group, and it was absolutely impaired. Like it was oxygen for me at that time. And fortunately, my husband was very supportive. He had said to me after we left Ria at the hospital after she passed, he was wheeling me out, and he said, "Sweetie," he's like, "we've got to go to counseling, or we've got to go to some kind of support group or something, because this is the stuff that makes people go crazy." And so it was so nice that he was willing to support. Both of us needed the support, but I'm more of a talker. And so I did the infant loss support group. I did go to a specific infant loss grief counselor for a few sessions. And I was really fortunate to have, because I had to go back to work in the hospital that I gave birth in.
Oh, wow.
And that was really hard, hard. Because not everybody saw me get bigger and bigger over 9 months, but not everybody knew that I had lost the baby. And so I'd walk in and they'd be like, "Oh, doctor, congratulations." And then I'd have to tell them. Yeah. And then some people would run the other way, or some people, it was very interesting. But there was a special nurse at that hospital who ran the infant loss support group at the hospital that I gave birth in. It's not the one that I was going to, but she ran it. And I had reached out to her and she reached out back to me. And she said, if you ever need anything, if you ever need to just come and talk, come and do that. And so I fortunately was able to do that. And so she held a loving space for me where I could go and literally cry for 2 hours, you know, or tell her about whatever it was that was bothering me, about whoever said something that upset me or whatever it was, you know, how people were reacting and I don't know how to handle it with my family or my parents or my in-laws or whatever. And she held space for me. And I had a best friend who walked every step of the way through me. And so talking about it and being fortunate to have friends that held that space for me was really what helped me a lot. I journaled also. I wrote letters to her in my journal. And I told wherever I went, you know, people ask you, I was on interviews for jobs, oh, do you have children? You know, and I'm like, yes, I do. and I take a deep breath and then I would tell them. Yes, and I would tell them a brief version of what I shared here today. And I kept a little photo album of pictures of her in my pocket. And I carried it with me. And if I felt comfortable with whoever was asking me, I would show them. And it was such a gift to me to be able to share her pictures. So that was a huge part. And actually, I want to share one other thing with you. I'm going to you with me. Hang on.
Okay.
This is something else. I'm going to share her picture with you now because you're going to allow me to. So, Maria. She had so much hair that I had to part it. And so her picture remains in my office along with my other living children.
Yes.
And I'm scared. Okay. And the other thing that wonderful nurse, her name was Judy, who held space for me so much during that year, got me through that last year of training. She handed me something called a Feely heart. And she said, keep it in your pocket, in your white coat pocket. And whenever life gets hard or whenever you're put in a situation that's just, you get overcome with grief, you know, you can hear a song or somebody can say something to you and boom, you're right back there with tears in your eyes, you know. And if you feel like you need to keep your composure, just carry this with you. And so I did. It stayed with me the whole entire year. And this is called a Feely heart. And it has a life of its own, actually, because for Ria's first birthday, my friends and I from the support group got together and made a whole bunch of these. Like one of my friends figured out how to make them. So we made a whole bunch of these and donated them to the support group.
I love that.
Yeah. And then my best friend who lost her son to stillbirth 4 years after losing Ria, she was the best friend who was with me throughout the entire labor and delivery and the 2 weeks after. She lost her son, Gavin. And we made a ton of Feely hearts for his memorial service. And we gave them out there. And then I make them for my patients. And I carry them in my white coat pocket for anyone who I may come across who's grieving. I give them a Feely heart and say that it's a soft place for their feelings to land. And so whenever, even on like, if I hear of someone who is suffering from some kind of a loss, I'll send a bunch out to them. So that is something that I'd love to create, like a movement where we're doing more of that.
Definitely. I love that. that. Yeah. And Marie stated on here, she said that was beautiful. And Vanessa thanked you for sharing her pictures. So thank you for doing that. That means a lot. I know that's
Thank you for allowing me to share it. Thank you.
Yeah, definitely. So, you know, when people have gone through a loss, you know, like we were talking about earlier, is that, you know, they see you're getting pregnant, you're getting bigger and bigger. It's your first child. They're all excited. And then they don't see your belly anymore. So then the natural, obvious question is, oh, how's the baby? What's the name? Where is she? Like, what what is the best way for people to ask about that? Because they don't know how things turned out for that person. And you don't want to be insensitive and not ask at all, but then you want to ask. And then if it's not an answer you were expecting, like, what is the best way to respond when a mom says, yeah, we don't have her, she didn't make it, or she passed away? What is the best way for them to respond so that they're not left with running away in the other direction or this awkward silence?
I'm so sorry. And may I give you a hug? That's it.
So simple. That's it. People don't really need much more.
And if you want more, what was her name?
Yeah.
If you have pictures, if you'd ever like to share.
Mm-hmm.
I would love to talk about it if ever you're ready.
Mm-hmm. Love that.
I'm here.
So just really being present and just offering your condolences, but not having, I think people feel the pressure to say some
profound,
everything happens for a reason. It's all part of the greater plan.
No.
Don't do that.
No.
Don't do that. And even though that might be true, nobody wants to hear that in that moment.
Nobody wants to hear. One of the worst things that people could say to me was, oh, you'll have another one.
Yeah. Oh, gosh. Yeah.
And I can tell you from my own experience, because I have been blessed to have 2 more children who know their big sister and very well, who celebrate their big sister's birthday every year. Mm-hmm. And I have been blessed. And no one can replace your child that has been lost.
Right.
They just can't.
Mm-hmm.
They just can't. And so the other thing is also checking in with that person who's lost their child. Like the whole thing about, oh, call me if you need me. Nobody's going to call you. Like,
no, they're not.
They're not going to.
They don't want to. They don't want to impose. They don't want to feel like a burden. They're not going to do it.
Right. So that's just not going to happen. But coming over or just calling and saying, I'm just checking in, wanting to see if I could take you to lunch, or I'm wanting to see I've been thinking about you and your child, or I thought of you and your child today. Use their name. Use their name. My daughter's name was Ria, Ria. You know, I thought of Ria today, or I saw this sign and it said Ria. Some of my friends, I was so fortunate. We had so many friends who were just incredible. I mean, we had friends drive across the country and sleep on the floor of our 1-bedroom apartment just to be there for us. And then so many of them donated money to a botanical garden and donated a tree in her name. I mean, these were things that, like, I honestly don't know if this had happened to someone else before I had experienced it. I don't know if I would have done all these things that my friends did for us. And I say all the time, they taught me how to be a friend. They taught me, because, I mean, the amount of grace that I experienced after this, the love that came pouring out, was unimaginable to me. And not only from the friends that I had, and there were some friends who, like, I thought I'd hear from that I never heard from, you know. But the strangers, the people who I didn't know, the cafeteria lady at the hospital, the janitor in the hospital, the social worker, like random people that, like, I just knew by face and I would smile. I didn't even know their name, would come to me and say, I heard what happened and I just wanted to give you a hug. And that, you can see even now,
it's meaningful.
It moves me.
Yeah.
These tears are not tears of sadness. They are tears of resonance and of being seen. And just knowing that someone else can feel that.
Right.
It makes you feel not alone in your grief.
Right. Definitely.
Yeah.
Thanks for sharing, Disha.
Thank you. Thank you for asking.
So what are the best, for anyone who's listening or wants to be able to provide support, or they need support themselves, what resources are the best for them to reach out for to help them heal through this journey? Because they have to know that healing is possible.
Yep, absolutely.
And to be able to know.
Here's the thing. It's like, I say this in my book, that,
which we'll talk about in a moment.
Yeah. So no, but what I want people to know is that I don't know if you ever really heal from this. It's your life changes and your normal changes. You have a new normal, and you start navigating your life with this being part of it. And so, look, it's been 10 years and I'm talking about it and I'm still getting teary, right? I can hear a song or read a card from someone and I can still get teary. So that's okay.
Right.
But it doesn't have to define your entire being, the grief part of it. It becomes part of your journey. So resources for someone who has immediately experienced a loss, finding an infant loss support group in your area is mandatory. You must. Some people don't like it. They say to give it at least 3 shots before you say you don't want to do it anymore. But at least give it a try, and you don't even have to sit there. You don't even have to say anything. You can just go sit and listen if it serves. I've heard some people it doesn't, but for me it was really helpful. Share, the capital SHARE, infant loss. It is a website that you can go to. It's a national organization for miscarriage and infant loss. Was tremendously helpful. It's got wonderful resources for people who have experienced any kind of child loss, and for people who are supporting them, who are trying to support them. So those are some great places to start. There's plenty. There's plenty. You just have to Google it. It's there.
And for those of you listening and watching, whether it's live or the recording, I know Disha because we are fellow ebook alum, and we have written. Well, we were going through the process of writing a book, and in our different specialty areas and experiences. And Disha she is working on a book about this topic, which will be available soon. So why don't you tell the listeners exactly what that's going to be, how they can get access to it once it's available?
Okay, so it is still a work in progress, but like I was telling Dr. Lockhart that she's lit a fire under my butt, and so I am going to get this book out. So right now you can go to DishaPhilip.com, and that's PHILIP, no double L, no double P's, no S's. And right now my email is there. And so if you're interested, you can always email me for pre-order. And, but hopefully I'm thinking in the next 6 months or so, I think we should get it sooner.
Yes.
Something will be there. And so we'll be able to share more details of the story. I plan on sharing a lot of the pictures that wonderful Todd Hawkbrook took, and also show you how you can still thrive in your life, and you can have deep meaning and deep connection with life, experiencing love and grace, more so because of the loss, and how, for me, I do consider Ria's presence in my life an ongoing experience. Her loss, my greatest tragedy, is also one of my greatest blessings.
So, Disha, share her full name and her date of birth with us.
You know what? I'm going to show you her tag.
Okay.
Her name is Disha Mookherjee Philip. You can see that. Is it backwards? It's backwards.
Yeah, it is.
It's backwards. May 6th, 2008. So this is the tag on the tree. And it reads, "Forever in our hearts, forever our precious little girl."
Love that.
Thank you.
Thank you, too. Thank you so much for sharing your heart and your child and your experiences with us. And I know that there's a lot of women out there, a lot of fathers, a lot of mothers, a lot of families that will be really blessed by this. So thank you so much.
Thank you so much for asking again. All right.
All right. Thanks, guys. Thanks for tuning in. And please feel free to share this with everyone else that you know. And it'll be up on Disha's page for the next 24 hours. And then after that, I will upload the video to my YouTube page. So that way you can have access to that after the 24-hour period. Okay. Thank you. Thank you very much, Disha.
Thanks
again.
Guys.
All right. Bye, guys.